The views expressed in this podcast are solely those of the speaker and do not necessarily represent the opinions of the Consumer Healthcare Products Association.
Welcome to CHPA Chat, conversations in the consumer healthcare industry with Anita Brikman.
Hello, everyone. It's time for another episode. And as you know, we talk a lot about self-care here on CHPA Chat. I mean, it's what we're all about. But today we're going to discuss an aspect of self-care that doesn't get the attention it deserves, at least in my opinion. Yes, it's sexual health. Here to talk with me about this is Bruce Weiss, VP of Health and Wellness at Church Dwight. We're going to talk about the state of sexual health in the U.S. today and the role of over-the-counter sexual health products in this broader conversation. This is new territory for me, Bruce. Welcome.
Thank you for having me.
Do you think sexual health is part of self-care?
Well, absolutely. Self-care is about maintaining one's well-being and happiness during times of stress. And what better yet than in terms of sexual health, where it's not just about physical health we talk about, but your emotional well-being too. So this all interlinked, is inextricably linked to self-care. And we believe at Trojan that people have a right. You mentioned before, it's something that doesn't get a lot of talk, sexual health. But we believe that you're going to be hearing a lot more about sexual health increasingly in the future because people are becoming more and more comfortable in our country talking about this. And I think that's a good trend that we see. And we do think that social media has played a real role in that.
Well, thank goodness that people are starting to talk about it more. You mentioned Trojan. Church Dwight makes Trojan condoms. They are widely available, yet I saw a statistic that STIs and STDs are at an all-time high. Now that shocked me. How is that possible?
It is true. It is it's a disturbing trend and one that is very fixable. STDs, specifically when we talk about chlamydia, gonorrhea, and syphilis, that's up. There was about in 2015 there was 1.9 million cases, and as recently as I think the last time I looked, 2019, the last year we have in record, that popped over 2.6 million cases
wow.
In terms of on average. So a big jump in that, and it's very easy to basically not get those diseases. And that's if you're going to have sex and you don't know your partner's status, or you should use a condom. And what we're seeing there is some behaviors that are easily avoidable in terms of behaviors that if you do use a condom, you can easily help avoid getting and spreading such diseases.
Absolutely. So let's talk about our young people. And I've had conversations with healthcare experts, gynecologists in general who treat younger women as well. Is there an issue with STDs in our younger people where they're not utilizing condoms the way they should?
Unfortunately, yes. First off, half of all STDs are occurring amongst young adults under the age of 25 and under. So this is really prevalent amongst our young population. And again, it's something, if you're going to have sex, use a condom. It's very simple. You can have good sex with a condom, and it's very easy to use them. And that's a lot about a couple of things. It's not just telling people to use condoms. It's giving people letting them know what are the benefits of using condoms. And I think really at the center of it, it's freedom from worry. Right now, we're seeing a big increase amongst the young population. And the part of that, I think, is that years ago, the specter of HIV and AIDS was very scary to people because you saw young people would see people that they knew on TV and that they knew of, friends, and there was basically people passed away. It was a terminal disease. Why right now it's more of a manageable situation. So they're not as familiar with that with HIV, AIDS as they used to be. The prospect of STDs, they sometimes just don't think about it. And that's why we want people to talk about sexual health so they're aware of this. And it's up to basically America to put ourselves back in the right position here, because even though it's not HIV has not gone away, it's still something you don't want. And all those other STDs, it's no fun, obviously, for people to get those. We want people to have fun, though. When they have sex, use a condom, and that's our message.
Such an important message. And like you said, some of the specter of the urgency and the fear around AIDS has diminished. But when you look at the ramifications of some of these STDs, impacts on fertility, infection, all kinds of things that can come down the road, young people don't always think about that. And I think it must be a tough message where you're trying to say, use a condom for good sex, but this also alleviates worry. But I'm also not trying to scare you to death on the STD stuff. It's got to be a fine line to walk, right? Because you don't want to lecture, but at the same time, you want to get this important public health message out there.
Anita, that's a great point. That balance. We don't want to come across as parental. We don't want to come across as waving a finger. We don't want to come across as too soft. What we want to come across as, and how we always think of as ourselves, as a mentor, almost as an older brother or an older sister, giving out friendly advice that's trusted. And when you're seen as that, you're not seen as necessarily an authority figure. You're an authority figure on sex, but not a judgmental figure. So we kind of turn something that's seen as maybe a little bit medical and a little scary, and we flip it on its head, and we make it seem as accessible and cool.
In this conversation I had with this gynecologist, she mentioned that some of today's generation of younger women, that there's been maybe a step backward in their feeling of empowerment to say, you know what, this is a deal breaker for me. Either you use one or this isn't happening. Is that part of the strategy as well, to encourage younger women to look at a condom as something they can buy, that they can have and have at the ready, as opposed to, or in addition to, other types of birth control?
Absolutely. We don't just target young men in the decision. You get much better compliance. So when two people are vested together, that's the best outcomes. When I have to say, the women at one time made up a very, very small proportion of condom buyers. It's still not where it needs to be. We would love to see it 50-50, but it's 2/3, 1/3. But that number used to be far lower. And when a woman is involved in the equation, we see much better consistency of condom usage over longer periods of time. I think what's very interesting is that the internet, e-commerce, has been a big positive for condom usage amongst women. Is that many women will say that they don't feel comfortable in the sometimes the experience of going to the shelf, that they feel judged, and there's a lot more anonymity to it. Ordering online, and we see that ratio online is closer to 50-50. That many women in monogamous relationships are ordering online condoms in bigger packs. So this is a great thing that we've seen going on over the past 5 years. That growth in e-commerce in the business.
Absolutely. And I was going to say, and you said, buying them in greater numbers, women tend to be more pragmatic than men. Just saying. When it comes to cost savings. All right. So we're talking about breaking down some taboos here. You mentioned social media earlier. How has that been helpful in getting people to talk about sexuality, pleasure, but also responsible sex to mitigate risk?
The benefit of social media is that 30 years ago, you had to rely upon, like I said before, a sibling to get information, your friends who knows the accuracy amongst that information you were getting from friends, and then parents. And some parents do have are very involved in the talk, and that's an important thing, because actually we see when parents talk to their kids about sexual health and about condom usage, about protection, about relationships, the best outcomes. come when parents are involved. But that's not everybody. So in terms of all parents are comfortable, but when they do, it's excellent. That's the best. The people have the best comm usage generally have in terms of have parental roles in terms of their quote information and education, and not all school systems. And this is something we very much believe in: comprehensive sexual health education. Here where I'm talking to you today from New Jersey has a very an excellent curriculum for schools, but that's only in less than half the states that are like that. So what that leaves is social media, and what that has, that has obviously has been a positive. Why some social media maybe is fraught, with misinformation, or but a lot of it is great. Has a lot of great sexual health content, and if you come to the Trojan website, you'll find a wealth of it, and we have millions of people, going to our site to get information because they're interested in knowing about not just condoms, but also sexually. Just get such great volume, reading about all our sexual health articles that we have on our site. So it's an example of people are still hungry for this. So the internet and social media have been good for spreading, for getting around information, for helping people make good choices, we think. And what a better educated person is going to make a better choice in their sex life. So that's what we're out here to do.
What did you see during the pandemic as far as trends in what people were buying, weren't buying?
That's a good question.
During the pandemic, what happened?
Yeah. Well, frankly, we saw different kinds of sex. The sex pandemic wasn't as kind to coupled sex because people were socially distanced. And so we saw, some drop in condom consumption during the COVID crisis. It is now returning, which for us is good news. But we saw a lot more sales of things like our vibrators and lubricants, and people were essentially, masturbation, was up, and that's health, and that's fine. That's healthy, and we do sell vibrators and have a sizable business in that. As long as, again, people are being safe, that's what we want. And I just want to say, when it comes to sexual health, we don't define sexual vibrators business and getting into things that give pleasure. It's not just about its protections, one aspect of things, but we see vibrators as a positive. Over half of adults have used a vibrator in their lifetime. Just under 40% of females have used a vibrator in the last year. This cuts across all age groups. Doesn't matter, red state, blue state, party affiliation, all the things that we say divides the country. In this case, we say vibrators unites the country. We are
sounds
very
like
much,
a political slogan there, my friend.
we are very much see that sexual health is not just about the idea of protecting from disease. Yes, it's a physical health, but it's also emotional health, and it's the right to pleasure, and that by doing safe pleasure makes somebody makes people happy, and that's a good thing.
And we talk about like the lifespan, and earlier we're talking about younger people and some of the behaviors that we need to change. But even as couples get older and women may be dealing with perimenopause and menopause, clearly there are changes that can affect sexual intimacy. But when you walk into the drugstore, there are more products than ever to help with issues like that, including some that your company makes. What can we do to help overcome any remaining taboos about saying, all right, I may have had a change in how I experience this, but there are products that may help me, I don't know, get that feeling back. Is that part of your strategy as well to normalize that? There is,
healthy aging. There's nothing wrong with aging. There's nothing to be judgmental about. Like we sell Brikman's vaginal moisturizer. It's a booming business for us. and because of the population is aging, and it allows people to enjoy sex comfortably. So we again, I think the thing is, why judge? There's nothing to judge. There's nothing wrong with any of these things. It's natural as long as we say it's consensual sex. Then that's what we that's the only line that we put up on it. So we think that it's curious. You mentioned about aging. We see people are having sex at plenty of people have sex at all ages. And there's a lot made about people when who are older. We hear stories about the nursing homes, when they're having sex. And yes, you should still use a condom. What do you call it at that age? What do you call it? Because you don't want to spread STDs. But so to all that, use a condom. But also, we want people to enjoy it. And we have the products to help them get there. But what's very interesting is that we do find people who are north of 65 who maybe there's divorce or a death, a spouse, and they come back into the dating game. And you know what? Using a condom at any age is still important. The specter of being if you're north of 65. You can pick up an STD just as much as if you were under the age of 25. So you want to be protected. So we're there for everyone.
I love that message. Safe, consensual, and a critical part of self-care. Does that sum it up?
That's tight. That could sound like you're writing a marketing brief.
Right. Bruce Weiss, thanks for joining me for this episode of Chippa Chat.
Thank you for joining us here at Chippa Chat. For more information and to hear our entire catalog of shows, please visit chpa.org.